Hello and welcome to today's episodes of The Science of Wellbeing, where we explore the latest innovations in healthcare and wellness. I'm your host, Dr. David Alonzo, and I'm thrilled to have you with me as we dive into one of the most exciting areas of medical research and clinical practice, and that is the use of GLP medications. Hi there and welcome. I'm Dr. David Alonzo, as I said, and I'm excited to kick off the very first episode of what I hope will be an inspiring and insightful podcast series all about health, wellness, and living your best life. A little bit about me. I'm a physician who got my start at Temple University School of Medicine, followed by advanced training in internal medicine at Dartmouth-Hitchcock Medical Center, subsequently became board certified. I've been in practice for nearly 20 years now. Over that time, my focus has expanded from general internal medicine to include hormone optimization, and in the recent years, really a heavy emphasis on obesity management and chronic disease prevention and wellness. This podcast is all about sharing the science behind staying well and thriving. We'll be talking about cutting-edge research, practical tips, and how we can all work toward living healthier, longer, and happier lives. Thanks for joining me on this journey. Let's dive in. Now back to today's show. So GLP-1 medications. These medications were originally developed for diabetes, but they become a game changer in the weight loss and metabolic health world. With groundbreaking research and new clinical applications emerging every day, GLP-1 therapy is reshaping how we think about obesity, chronic disease prevention, and even cognitive health. As a physician and clinic director, I've had the privilege of working closely with hundreds of patients on their weight loss journeys using these GLP-1 therapies. Over the past 18 to 20 months, our clinic has helped over 600 people achieve remarkable results with a collective weight loss of nearly 24,000 pounds. This work has been deeply rewarding to myself personally and has reaffirmed my belief in the importance of personalized, evidence-based care. In today's episodes, I'll be sharing some of the exciting developments in the GLP-1 therapy, highlighting some recent research, and discussing how we're using these innovations to improve patients' lives. Along the way, I'll share a few patient success stories and explain why I'm so passionate about helping people achieve a healthier weight and metabolism. Really, whether you're a healthcare professional, someone considering weight loss therapy, or just curious about the science behind these breakthrough medications, this episode's for you. My goal is to keep things informative yet easy to understand so you can leave with a clear picture of why GLP-1 therapy is creating such a buzz and how it might benefit you or someone you know. So let's get started and dive into the world of GLP-1 therapy and its incredible potential to transform health and well-being. Let's start with the basics. GLP-1 receptor agonists are a class of medications that were originally developed to help manage type 2 diabetes. GLP-1 stands for glucagon-like peptide 1. It's a hormone that's naturally produced in our gut. It plays an important role in regulating blood sugar and appetite. These medications work by mimicking the natural GLP-1, binding to its receptors and activating them to reduce hunger, slow stomach emptying, and improve insulin sensitivity. The result? Significant weight loss and better glucose control. But the GLP-1 isn't the only receptor making waves in this space. Other compounds are being developed to target similar receptors in the same family. For example, we have the GIP receptor, that is the glucose-dependent insulinotropic polypeptide, or GIP, which is another gut hormone that also enhances insulin secretion in response to meals. When combined with the GLP-1 receptor agonists, they really seem to amplify weight loss and the metabolic benefits. And there's also the glucagon receptor agonists. These tap into the glucagon pathway, traditionally known for raising blood sugar, but in weight loss therapy, glucagon receptor agonists work synergistically with the GLP-1s and the GIP to increase energy expenditure and reduce body fat. These receptors are part of a larger family called G-protein coupled receptors. GPCRs are found on the surface of cells and are responsible for transmitting signals from the outside of the cell to its interior. When a hormone like the GLP-1 or GIP binds to this receptor, it triggers a cascade of events inside the cell, influencing everything from metabolism to appetite to glucose regulation. In weight management, researchers are exploring these receptors not in isolation, but as part of a dual or even triple agonist therapies. For example, an agent called retatrutide, a triple agonist targeting GLP-1, GIP, and glucagon receptors, has been shown to be the most dramatic weight loss results so far, with upwards of nearly 25% weight loss at about a year, really highlighting the potential of leveraging these multiple pathways working together for even greater therapeutic benefits. What's particularly exciting about the GLP-1 receptor agonists is how effective they've proven to be, not just for managing the type 2 diabetes, but also for achieving significant weight loss and improving overall metabolic health. Recent studies have shown incredible results, and the field continues to evolve with new and more advanced therapies. So let's start with the numbers. A recent systematic review of 26 randomized controlled trials compared several GLP-1 medications together. What did they find? Well, that triple agonist that we were talking about, retatrutide, which I should say is not yet FDA approved for clinical use, demonstrated the most weight loss. Next, below that, was the agent called tirzepatide, which is a dual agent, working on both GIP and GLP-1 receptors, achieving nearly 20% weight loss over the course of the study, then followed by semaglutide, which is a single GLP-1 receptor agonist, which showed a very impressive nearly 17% weight loss over the course of the study. So whether we use a single receptor or dual or eventually a triple, we have a lot of opportunities to really try to help with appetite suppression, improving energy regulation, and glucose regulation. So beyond weight loss, we have other benefits. Some of these other benefits, for example, include Alzheimer's disease risk reduction. What fascinated me this morning was relooking at a study that's analyzing over 1 million patients, finding that semaglutide reduced the risk of onset of Alzheimer's disease by up to 70%, and that was in people with type 2 diabetes. This benefit is thought to come from the GLP-1 receptor agonist crossing the blood-brain barrier, reducing inflammation, and improving neuronal function. We're also seeing improved surgical outcomes. With the use of the GLP-type therapies, we're seeing that help patients meet weight or BMI thresholds before they can undergo surgeries, such as joint replacements. Aside from just meeting these BMI cutoffs, research suggests that patients using these medicines experience fewer post-operative complications, which leads to better or improved recovery. We also see cardiometabolic benefits. These medications not only lower body weight, but also reduce blood pressure, waist circumference, cholesterol levels, which collectively decrease the risk of cardiovascular disease. In addition, ongoing research into new formulations and delivery methods is pushing the boundaries of what these therapies can do. Oral GLP-1 formulations such as orforglipron and experimental agents that are coming into development, these medications are showing promising weight loss results ranging from 6 to 15% depending on the compound and dosage. So not perhaps quite as much as some of the injectable agents, but do provide another alternative for people who are not keen on the idea of an injection. Finally, we have the EVOKE or the EVOKE Plus trials, which are currently underway, evaluating semaglutide for treating mild cognitive impairment and early Alzheimer's disease in amyloid-positive patients. If successful, these studies could open an entirely new avenue for GLP-1 therapies in neurodegenerative disease management. The consistent theme across all of these advancements is the transformative potential of the GLP-1 receptor agonist family and along with their co-agonists. So not just weight loss drugs, but really multifunctional therapies with far-reaching benefits for metabolic, neurologic, and overall health. Another emerging role for the use of these medications has that been in actually potential prevention of cancer. Emerging evidence has suggested that certain GLP-1 agonists might reduce the risk of some cancers, particularly those that are associated with obesity. While this area of research is still in its infancy, the ability of these medications to lower insulin resistance and reduce systemic inflammation could play a key role in decreasing the cancer risk. So researchers have been working on expanding the drug formats, delivery methods, as we talked about. Typically, GLP-1 medicines are given as a subcutaneous injection. Some of them are daily, some of them are weekly. They're working on the oral GLP-1, as we talked about, once daily pill that could offer a non-injection alternative. We see also the dual agent medicines such as tirzepatide. We see the studies ongoing of the triple agonist medications like the retatrutide, which is really trying to push the boundaries of weight loss efficacy to really offer greater reductions in both body weight and health improvements than we see with some of the single agents. So really some closing thoughts about GLP-1 medications. It's really that these medicines are more than just weight loss drugs. They truly give us a way to redefine how we treat metabolic and chronic disease, from managing the risk of obesity to reducing the risk of cognitive decline. The potential of these therapies is truly exciting, and while there's not a one-size-fits-all solution, the science continues to evolve, offering new hope for patients and clinicians alike. Next, I want to touch on the clinical impact and some patient stories. And now that we've really explored the science and exciting advancements in GLP-1 therapy, let's shift gears a little bit to something a little bit more personal, the real-world impact of these medications and what they're doing to patients and patients' lives. As someone who's been actively working with GLP-1 therapies in my clinic, I've witnessed firsthand how these medications can change lives. Let me share some of those stories and highlight the broader clinical significance of several stories. One of them that comes to mind is a patient who was advanced in years, shall we say, struggling with weight, struggling with the limitations that come from that, feeling tired, joints that hurt, inability to get up, get moving, has struggled with weight loss for years. Often when I would see this individual in the clinic, would counsel them about different dietary strategies and so forth. But really nothing was able to be effective, was not able to make progress. Finally, one day, after these medications had been made available, when this person presented to the clinic, essentially saying it's time in life to give up and be done. Couldn't face going on anymore with the inability to make progress. So before we do that, let's get you started on one of these medications. In that particular case, we chose to use tirzepatide. And if I fast forward a year, it was remarkable to see the improvement. Coming back at a year after we've worked consistently through that time, this person had achieved a nearly 100-pound weight loss. What was more remarkable than the weight was the attitude. Coming in, seeing this individual smiling, wearing now workout clothes, and saying, "Doc, guess what? I'm going to the gym after this." Something that would have been unheard of to come from this patient just a year before. Really giving a new outlook on life, a new trajectory in life. Another individual, someone who is on chronic oxygen dependent because of lung disease, COPD, weighing in at somewhere around the 240-pound range. Over the course of time, it's been exciting to see this person get down on their weight, has lost nearly 80 pounds over the course of about 16 months, no longer requiring oxygen for normal activities, really in a better state of health now, feeling better, not tied to that oxygen canister. It's really remarkable to see those changes. This is the kind of transformation, such as giving people the freedom to move, giving people a sense that they can get up off the couch without being in pain, that really makes this work so rewarding. Some of the other things that can come up during this. One is really, what can this do to muscle? Because rapid weight loss, especially that facilitated by the GLP-1s, can sometimes lead to reduction in muscle mass, or what we call fat-free mass. Studies have indicated that a significant portion of weight loss through these therapies can come from this fat-free mass loss. This is concerning because maintaining muscle mass is crucial for metabolic health, physical strength, and really overall well-being. So there's some very key strategies that can minimize this, and in fact, I would argue completely prevent this. So to mitigate the weight loss, the muscle loss during weight reduction, we consider the following strategies. One is adequate protein intake. And this has been shown in clinical trials. Aim for daily protein intake of approximately 1.5 grams per kilogram of body weight. The average recommendation for people is 0.8 grams per kilogram. So this higher level of protein consumption supports the muscle maintenance during these times of caloric deficit. Second key component is incorporating resistance training. So engaging in regular resistance or strength training exercise is vital for preserving and building muscle mass during weight loss. These exercises stimulate the muscle fibers, promoting growth and prevent the deterioration. So some things we may think of that you can do on your own at home without equipment would be something like squats, which is a movement that's targeted at working out the quadriceps, the hamstrings, the gluteal muscles. We can consider things like lunges, which are going to also focus on the quadriceps, hamstrings, glutes, but also work on enhancing lower body strength and balance. Pull-ups. Now this is a much more challenging activity, targeting the upper back, shoulders, and the biceps. How often do we want to do these? We want to incorporate these into our routine at least 3 or 4 times per week to effectively combat muscle loss. It's true that any activity is better than none, but we really, to get the best benefit, want to be doing these regularly. Make sure it's part of your routine activities. Also, we want to maintain a moderate calorie deficit. Aim for a gradual weight loss. Again, if we're rapid weight loss, more likely to lose muscle. If we're getting 0.5 to 1% of our body weight loss per week, that's going to help to minimize some of the stress that's going to put on our muscles. We want to ensure adequate recovery and sleep. Muscle repair and growth predominantly occur during rest. So we want to strive for 7 to 9 hours of quality sleep each night to really facilitate muscle preservation. Staying hydrated, managing stress, also very important. Proper fluid intake supports metabolic function and muscle health. High stress levels can contribute to muscle breakdown, so incorporating stress-reducing activities such as yoga, meditation, they can be beneficial. So really, by incorporating all of these strategies, adequate protein intake, regular resistance training, maintaining the appropriate caloric deficit, ensuring sufficient rest, managing stress, you can effectively minimize muscle loss during rapid weight loss or during the weight loss journey. This is a comprehensive approach. Not only supports the preservation of muscle, but also enhances overall health. Overall, GLP-1 receptor agonists aren't just for weight loss. We've been hearing that over and over. They're about changing lives. For many patients, the benefits extend far beyond the numbers on the scale. It's leading to profound improvements in physical health, mental well-being, and overall quality of life. Let's look at some of these things in more depth and highlight some of the disease conditions that significantly improve with weight loss. We see improved mobility and joint health. Weight loss reduces strain on the joints, easing pain, improving mobility for patients with conditions like osteoarthritis. Studies show that even a 10% reduction in body weight can significantly decrease joint pain and enhance physical function, allowing patients to regain independence and perform daily activities comfortably. Like the individual I mentioned earlier, the one who had achieved over 100 pounds of weight loss was now able to get up out of the chair, get up off the couch without hurting. That's a significant direct improvement. Number 2, we see better cardiovascular health. Obesity and poor metabolic health are major risk factors for heart disease. So we see lowered systolic and diastolic blood pressure, so lowering your blood pressure. We see improved cholesterol profiles by reducing the LDL and triglycerides. We can often see increasing of our good cholesterol, known as the HDL. We see reductions in systemic inflammation, which inflammation alone has been linked to atherosclerosis and heart disease. So as a whole, these improvements lower the risk of heart attacks and strokes, both in the short term and the long term. Another benefit, number 3, we can see diabetes remission. Weight loss through GLP-1 therapies can significantly improve blood sugar control and may, in some cases, even lead to the remission of type 2 diabetes. By the reduction of insulin resistance and promoting pancreatic beta cell function, these medications address the root cause of diabetes rather than just managing the symptoms. Other conditions, number 4, sleep apnea relief. Excess weight, particularly around the neck, can contribute to obstructive sleep apnea. Weight loss reduces airway obstruction, leading to improved sleep quality, reduced snoring, and decreased reliance on CPAP devices. In fact, just last week, tirzepatide or Mounjaro, sold under the brand name Zepbound, was just approved for treatment of sleep apnea. And I suspect we'll see more of those types of approvals in the near future. We see improved mood and mental health. Many patients report improvements in mood, self-esteem, and confidence as they lose weight. This is particularly important because obesity is often associated with depression and anxiety, creating a cycle that can be hard to break. The GLP-1 therapies may also have a direct effect on the brain health by reducing that neuroinflammation, which we think may potentially also directly enhance mental well-being. All of this, we see enhanced quality of life. Patients frequently share the stories of being able to engage in activities. We've already talked about some of those. Activities that they had long given up, such as playing with their children or grandchildren, hiking, participating in sports. These regained moments of joy and connection are often described as the most rewarding outcomes of their weight loss journey. Moving on with some of the disease-specific improvements, we've touched on Alzheimer's disease before, how we think there may be a reduction in Alzheimer's by improving neuronal health. The thought is that this may reduce the amyloid and tau protein buildups, which are thought to be associated with Alzheimer's, and also lowering the systemic inflammation. This can have enormous implications for cognitive health and aging. As I mentioned, blood pressure can be lowered, so one of the most common things I'll see change when we help someone with weight loss is the fact that we need to lower or discontinue someone's blood pressure medicine, which in turn is then going to lower their risk for kidney disease, stroke, and other problems. Now, an interesting one is polycystic ovarian syndrome. Women with PCOS, weight loss improves the hormonal balance, reduces insulin resistance, increases the likelihood of regular hormonal function, which would lead to regular ovulation and actually improved fertility. So the GLP-1 therapies are becoming an emerging and effective tool in managing these PCOS-type conditions. And this next one is cancer risk reduction. We touched on it a little bit earlier, but we know that obesity is a risk factor for several cancers, including breast cancer, colon cancer, endometrial cancer. Weight loss is known to reduce levels of circulating insulin, inflammation, two pathways also linked to cancer development. So I'm excited to see as more research is going to unfold on what is that direct impact, or can we have a direct impact on reducing cancer with the use of the GLP-type medications. Now, fatty liver disease, that has very rapidly become a very serious issue in our country. Weight loss can help reverse fatty liver fat buildup within our liver. And these medications have also been shown to really aid to that. So we believe we can reverse this non-alcoholic fatty liver disease. Kidneys, chronic kidney disease, improving the metabolic health, reducing the blood pressure, may slow and has been shown to slow the progression of chronic kidney disease in people who have obesity and type 2 diabetes. So the improvements in quality of life that accompany the weight loss and the GLP-1 therapies really can be transformative. From reducing the risk of chronic disease to enhancing mobility, mental health, and overall vitality, these therapies often offer patients a chance not just to live longer, but to live better. It's about helping people regain control of their health and experience the fullness of life in ways that they may not have thought possible. And for those of us in the field, there's nothing more rewarding than seeing those changes unfold. As I mentioned earlier, over the past 18 to 20 months, our clinic has seen remarkable results with GLP-1 therapies. We've helped over 600 patients collectively lose nearly 24,000 pounds. These aren't just numbers. They represent lives changed, chronic disease risks reduced, and futures brightened. And I'm proud to say that our success comes from treating the whole person. GLP-1 therapy is just one of our tools in our arsenal. We like to combine that with personalized coaching. We like to check in with people regularly, have pretty regular follow-ups, and most importantly, listening to what our patients need. Every patient journey is unique, but a common thread is the transformative power of these therapies when paired with thoughtful, personalized care. Whether it's helping patient qualify for surgery, or maintain their muscle mass, or simply enjoy life again, the impact of these medications is undeniable. In the next segment, we'll explore some of the challenges and controversies surrounding the GLP-1 therapies, as well as some of the strategies to address them. So far, everything has sounded pretty rosy, a lot of tremendous benefits. This also has to be taken with some seriousness. These are medications that have amazing positive benefits, but they do come with some challenges and controversies. So understanding these is critical for healthcare providers and patients alike, so that way we can maximize the benefits while minimizing the risks. One of the first challenges I'd like to discuss is simply the accessibility and the cost of these medications. These medicines, especially the newer options, the ones that would be the generic names semaglutide or tirzepatide, come with a pretty high price tag. Monthly supply can cost well over $1,000, upwards to $1,500 without insurance, making that really inaccessible to most people. Even with insurances, a lot of times the coverage varies. When it's for weight loss, there's almost very little coverage, or there's coverage, but the copay is still about $500 to $600 a month. Many plans require prior authorizations or deny coverage altogether. This really raises important questions about health equity and how we can prioritize access to effective therapies for obesity. a condition that affects nearly half the population. This is an issue that's come up recently with the FDA. There have been, up until now, an allowance from the FDA for generic or what are called compounding pharmacies to make a generic alternative to the commercially available brand name medication. With some recent rulings that came out in the last 2 weeks, as of right now, they may put a stop to that in about a month. It's concerning how this is going to affect people, because for those who don't have coverage to their insurance, having access or having the opportunity to access medications through compounding pharmacies have helped to reduce the cost burden significantly. Whereas the cost may be $1,000 to $1,500 out of pocket from the pharmacy, the compounding pharmacies often have costs that would range from maybe $300 to $500 a month for an equivalent medication. So we have yet to see how that's going to unfold with the FDA, but there's a number of groups that are advocating for the continued allowance of these generic manufacturers to be able to continue providing an opportunity for those who cannot afford or do not have coverage for the commercially available products. So something else we want to consider simply are side effects, tolerability. Like all medications, GLP-1 receptor agonists have potential side effects. The most common are gastrointestinal in nature. That would include things like diarrhea, vomiting, nausea, constipation. And it's fair to say that these symptoms do affect up to 60 to 80% of people who take them. However, thankfully, these are typically mild and transient, especially if you're working with a knowledgeable provider that can help you work through those. However, in some individuals, these side effects can be severe enough to lead to the discontinuation of the medications. Studies have reported the discontinuation rates due to these side effects range from anywhere from about 6% to 26%. To address this, we always employ a gradual dose escalation. We start with a small amount, we increase it over time as tolerated. We want to modify the diet, such as eating smaller meals, maybe more frequently. These are some key strategies to help mitigate some of the side effects. In our own practice, I would say that I see more of in that 6 to 10% who may find that they don't tolerate it. Certain medicines are more well tolerated than others. We find, for example, that tirzepatide is more well tolerated on average than semaglutide. The other consideration in side effects is, as we've discussed earlier, is this issue with muscle mass loss. Rapid weight loss can result in muscle mass loss, which raises its own concerns about long-term health. So it's important to lose weight in a structured, supervised fashion, so that way we don't add to our risk associated with weaker muscles. Particularly important in those of us who are older adults who want to monitor more closely. So to combat this, we emphasize the importance of combining this with strength training or resistance training and adequate protein intake. So this need for the lifestyle modification does add a little bit of complexity to the treatment plan, but it's something that should be done and embraced as part of a healthy life. Another area of controversy is whether or not people will become dependent on this type of medication. Will they need this for long term or even lifelong in order to maintain their weight? So studies have shown that when you stop abruptly, weight regain is common. However, when they've done the studies, they've seen regain of about 2/3 of the weight on average, not the entire amount. We have to keep in mind that obesity in itself is a chronic disease. We have to think of it in those terms. So therefore, we want to be addressing something chronically when we're talking about treatment, whether that be with the GLP medication itself, or whether that be with how we've changed our lifestyle, how we've embraced new exercise routine, how we've altered our diet such that we now eat smaller meals, we eat less, we eat a little bit more frequently. Those tools can help us in the long term, and we've been able to see successfully many people lose the weight, get off their GLP medication, and then maintain their weight. In fairness, not everyone has that. Some people find that once they've achieved their goal weight, they do stay on a very low dose, or what we might call a microdose of medication, sometimes taken weekly, sometimes taken every other week, or even once a month, as just a little tool to help them maintain that progress that they've worked so hard to achieve. So what are some of the rare but more serious side effects? Well, generally these are very safe medications. There are some rare but serious side effects that need to be considered. One of those would be gallbladder issues. Rapid weight loss can increase the risk for gallstones or a gallbladder attack known as cholecystitis. Another condition would be pancreatitis. Although that's rare, there have been reports of pancreatitis in people using these GLP-type medications. Gastroparesis, a slowing down of the stomach, can be exacerbated or unmasked in some patients with GLP medications. Again, this speaks to why it's important to utilize these medications under medical supervision with a knowledgeable provider. Another concern could be what I might call societal misperception, or maybe even misuse. There's been growing concern about the societal perception of GLP-1 therapies and their potential for misuse. While these medications are transformative for patients with obesity or metabolic disorders, they are increasingly being sought after by individuals who don't really meet the medical criteria for need for weight loss. There's a concern that this can divert resources away from those who might need them most, and potentially lead to fueling unrealistic beauty standards. Really, despite these challenges and controversies, GLP-1 therapies remain a powerful tool in the fight against obesity and metabolic disease. By addressing these issues, improving access, managing side effects, and ensuring appropriate use, we can continue to harness the benefits of these medications while mitigating their risks. Next, we're going to talk about exploring the possibilities on the horizon for GLP-1 therapies. As we look ahead, it's clear that the story for GLP-1 receptors is just beginning. These therapies have already revolutionized weight loss and metabolic health, and ongoing research and innovation promise even greater possibilities in the future. So let's explore some of what's up next for the GLP-1 therapies and how that can reshape healthcare. As we've mentioned, there's some work on oral agents, this orforglipron, and showing promise as being an effective non-injection-based alternative. There's exploration into longer-acting options, extended release formulations such as once-monthly injections that may help reduce the dosing burden and just the discomfort associated with taking an injection. We've touched on the dual and triple agonists like tirzepatide, the currently available GLP-1 GIP agonists, and then hopefully soon to be available retatrutide, which is a triple agonist that seem to better capitalize on all of these G-protein coupled receptors to enhance the weight loss effect and the health benefits. Also, I'm excited to learn more and we can monitor more about the role in chronic diseases. We talked about the studies ongoing for Alzheimer's disease, the trials like EVOKE and EVOKE Plus that are currently investigating to determine the exact impact that semaglutide is going to have on reducing cognitive decline. We think of the potential impact that that could have on our society as we have an aging population. We're going to learn more in the horizon on the impact on cardiovascular disease. We know that cardiovascular disease is still the #1 cause of death across the board in our population. So anything we can do to reduce that can have a major impact on society. And also, as exciting is this cancer prevention. As we've touched on earlier, I'm really excited to monitor the research and as we look at that emerging evidence to really see how we could potentially prevent or reduce the risk of cancer by improving our metabolic health. You know, in time, as we learn more about the science of obesity and metabolic health, we see that some of these therapies could become a cornerstone in personalized medication. We look toward potential advances in genetic testing and biomarker analysis that might allow us to further tailor treatments to individual participants so we can optimize efficacy while minimizing side effects. Additionally, these therapies could play a preventative role in helping at-risk individuals manage weight and metabolic health before chronic disease develops. As time goes on, one thing we could be confident that as there's more broad access and integration, that we should be able to see the cost of these medications decrease. And therefore, there will be more availability, and that should allow us to have a greater impact on society as a whole. So when we partner those with a comprehensive care model, combining medication with nutrition counseling, exercise programs, and behavioral health, we can further enhance those outcomes. The goal is not just to simply treat the scale, the obesity, but really create lasting changes in our overall health and quality of life. So as we come to the conclusion of today's podcast, as we start to wrap up, we can really take a moment to reflect on what we've covered. GLP-1 receptor agonist, this GLP-1 medication, has truly revolutionized the way we approach weight loss and metabolic health. We've explored how these therapies work, the incredible advances in what are becoming now the dual or triple acting agonists. We've seen how this can improve the weight loss that's needed to safely and recover from surgery. We've discussed the real-world impact on patients. We've seen how lives are changed, the improved mobility, reduced risk of disease. And also, we didn't shy away from the challenges, the side effects, the cost, the complexities of long-term use. But we also recognize the strategies and ongoing research addressing these issues. Finally, we look to the future, where these medications could expand into treating neurodegenerative diseases, improving accessibility and becoming part of a broader approach to personalized and preventative medicine. It's really an exciting time to be in this field of medicine and to witness these transformative breakthroughs. If you're a patient struggling with weight loss, or you're a provider considering incorporating these therapies into your practice, I encourage you to explore the possibilities. These medications are powerful tools, but their true potential is unlocked when combined together with that comprehensive care plan tailored to each individual's needs. Thank you for joining me on this deep dive into the current status of the GLP-1 therapies. It's a topic close to my heart, not just as a physician, but as someone who has seen firsthand the profound changes these medications can bring to my patients' lives. If you've enjoyed today's episodes, please consider subscribing to the podcast and sharing it with others who might find it helpful. And if you'd like to learn more about what we're doing in our clinic or have questions about GLP-1 therapies, feel free to reach out. I'd love to hear from you. Until next time, take care and stay well.